I'm Saab Nasser, studying faculty of pharmacy at Suffolk University. I'll speak about diagnosis of congenital heart disease in USA. Congenital heart disease increases the rates of morbidity and mortality. So several studies have been done to find what is the best method for the detection and to what extent early detection may improve the survival outcomes. Also, there is studies try to know the causes of congenital heart disease. In that review, we'll show some of these studies which try to screen the outcomes of prenatal diagnosis and knowing if gene interaction may cause these defects inside UCA centers. Um, our first study is prenatal and newborn screening for critical congenital heart disease find from a nursery. That try to find the best method of detection. Is it a post-oximetry screening or fetal echocardiography of postnatal clinical presentation? They worked on neonates of more than or equal 35 weeks gestation born in both two centers, Boston and Brigham, and they analyzed critical congenital heart disease post-oximetry screening. They identified patients with prenatal diagnosis of that defect. They also identified infants born at other medical centers that were transferred to Boston Hospital for critical congenital heart disease and determined if the condition was diagnosed prenatal. 99.5% passed the first screening. One infant failed all three screenings and had the only echocardiogram prompted by screening that showed resistant pulmonary hypertension. There was one false negative screening in an infant diagnosed with interrupted aortic arc. In tertiary care setting, post-oximetry didn't detect an infant with critical congenital heart disease because of effective prenatal echocardiography screening. Post-oximetry will detect more infants in settings with a lower prenatal diagnosis rate. Improving training in complete fetal echocardiography scans should also improve timely diagnosis of critical congenital heart disease. So prenatal diagnosis is useful. Second study delayed the diagnosis of congenital heart disease defects, trends, and associated factors. They aim to evaluate trends of diagnosis and factors associated with delayed diagnosis. They worked on cases diagnosed through 1 year of birth between 2004 and 2009, and they reviewed maternal and infant medical records. They classified the congenital heart disease as critical if corrective surgery or interventional catheterization was performed, if palliative care was administered, and if the infant dies of defect-related causes within the first year of life. According to initial diagnosis, cases classified to prenatal diagnosis at the birth or transfer hospital before discharge home or delayed and according to care level of delivery centers, they classified into also 3 levels. Then statistical analysis were done. They found that 13.8% had delayed diagnosis, and results showed an increase in rates of prenatal critical congenital diagnosis and a decrease in rates of delayed diagnosis. Finally, reported that 10% of delayed diagnosis still occurred despite all measurements to stop it. So identifying risk factors that cause it may decrease that rate, and it could help to improve prenatal and postnatal screening efforts, including post-oximetry testing. Our studies speak about variation in prenatal diagnosis of congenital heart disease in infants. With knowing the benefits of prenatal diagnosis of congenital heart disease, especially in critical cases, Michael noticed that there is no assessments in national prenatal detection rates in USA. So that studies try to provide assessment across geographical regions in USA. The Society of Thoracic Surgeons Congenital Heart Surgery database was used in that study. Include all cardiovascular operations in neonates and infants less than 6 months of age. They exclude patients with a history of previous cardiac surgery and centers with more than 15% missing data for prenatal diagnosis. They classified defects with its ability to be diagnosed on a prenatal screening by ultrasound for chambers view. Then analysis among patients included in that study, the rate of prenatal detection occurred in 34% and increased across 6 years. Study they noticed a significant geographic variation in rates of prenatal diagnosis across 3 states. At the end, Michael reported that prenatal diagnosis rates are still low in USA and vary across regions. Also said that prenatal diagnosis rates vary significantly across defect type, with those having abnormalities on for CRP being more readily identified. Our fourth study speaks about gene interaction as a cause of congenital heart disease. Specific a three-way interaction among maternal and fetal variants contributing to congenital heart defects. A congenital heart disease mostly developed from genetic variants, epigenetic modification, and maternal environmental exposures. That study focused on genetic one, especially complex gene by gene and gene by environment changes. All subjects were participants of National Birth Defects Prevention Study. It was case control study. Cases were between 97 and 2008. They included items with their respective maternal age, race and ethnicity, maternal education, household income, folic acid intake, alcohol consumption, cigarette smoking, and maternal obesity. Families were balanced in the population. External quality assessments for high throughout genotyping platform. They used method as Illumina Golden Gata Assay. They applied likelihood ratio Mann-Whitney method to detect joint actions among maternal variants, fetal variants, and maternal environment exposure, allowing for high order statistical interaction. Among 3 variants within gene, fetal SNP RS62, maternal SNP RS21, and RS81, SNP RS62 was associated with various complex disease and birth defects, and with more examination, Meng found that SNP RS21 may interact with both fetal SNP RS62 and maternal RS81. Then Meng reported that the risk of congenital heart disease may be influenced by both the intragenerational interaction within the maternal genome and the intergenerational interaction between maternal and fetal genomes. That shows the fetal SNP RS62 and the maternal RS21 possible interactions, the interaction between the two genes. And here RS62 and maternal 81 that shows a possible additive effect. And here maternal in conclusion, although all measurements that were taken in USA for early detection of congenital heart diseases, defects still occur. On the other hand, gene interaction may be a serious cause for congenital heart defects and other defects. More screening and studies are needed in that field. Acknowledgement. This study supported by International Medical Research School. Thank you.